It is the wave of the future. Electronic files are replacing the paper files at doctors' offices and hospitals. And this is good news for you and me. It could save you time and money. Most importantly, result in better health care for your family.
If my patient got seen in an emergency room in San Jose over the weekend, I have that in my inbox when I get back in on Monday.
Dr. Brian Guthrie is the chief of pediatrics at Kaiser Permanente Medical Center in Fresno. He has experienced the transition from old paper medical records to this new electronic format, benefiting both the doctor and the patient.
I think one of the biggest ways it helps us is, number one, we have the records, so we're not having to go blind. Number two, it's legible. Everything is visible, it's all typed, I can find things. It's also quite organized. In the old paper record, things not always were in the right place, and when you're talking about records sometimes that were hundreds of pages long, that was a problem. Now it's all tabbed, it's all available, so if I need to look at medications, I go to my medications tab.
Patients have access to this information online as well. It's a feature that has brought a tremendous amount of reassurance to parents, such as Meredith Murillo. She takes her 1-year-old daughter to see Dr. Guthrie.
It's extremely comforting because as a new parent, I think you tend to question a lot of things that you do and are wondering if you're either overanalyzing something or maybe not paying attention too closely. And so it's always nice to have the advice of a professional available. And I can't tell you how many times I would thumb through books as I was going to bed trying to find the answer to a question or a condition. And what's great is I can just go online to her record, email her doctor about something, or even have the links available to look up that information. So it's really nice to have it all in one place.
The electronic medical records utilized by Kaiser Permanente allows patients to set up appointments online, look up vaccination records, review previous appointment summaries, refill prescriptions, learn more about their medications, and even email their doctors about non-urgent medical conditions.
We had a situation where the daycare providers had told us that another baby in our class actually had RSV, was diagnosed with that. And so there was some concern that perhaps Ellie had it because she had come down with a fever that same day. So trying not to panic and rushing to the doctor right away, instead went home, emailed Dr. Guthrie, actually had a response within an hour. And he put to rest some of my concerns and actually gave me advice on what I should look out for if in fact she did develop RSV.
The ease of internet communication, as well as the electronic management of medical records, is not only convenient, but it also allows for additional safety features to be put in place to protect the patient.
Our prescription feature, which allows us to send all our prescriptions electronically, has built into the system a number of safeguards, including an allergy trigger. So if anyone has an allergy that's listed in our record and you try and prescribe a medication that's either in that class or even sometimes related to that class, you'll get an alert, a colored alert on the screen that forces the provider to go through a number of steps to either override that allergy because they know something about their tolerance of a particular medicine, or to say, oh yeah, I really can't prescribe that. Sometimes the patients don't even recall, oh yeah, I had that allergy, but if it's in the system, then it'll safeguard them.
It's these types of features and easy access to information that Dr. Guthrie feels really helps to provide timely, high-quality care to all he serves.
You know, it's very convenient, and there's some comfort in knowing that that information is always available to me, regardless if I'm here at home, at work, or even in another town.
Medical providers may face penalties if they don't make the electronic transition by the year 2015. They could see reduced Medicare and Medicaid payments from the federal government. If you would like to learn more about electronic medical records, go to kvpt.org and click on 0 to 5 in 30 minutes.
This program funded in part by First 5 Fresno County. At First 5, we focus on the first 5 years of life. We fund programs and services that better the lives of children in Fresno County.
Additional funding from First 5 Tulare County. Changing lives and building futures. Because it's all about the kids.